I was at my daughter's house and I stood up and I had a stress fracture because my legs were so crooked. I was in a wheelchair and he's looking at my ankle and all of a sudden he's looking at my legs and he said, "Can you stand up?" And I said, "Well, with help, because my ankle's fractured." He's looking at my knees and he said, "I could fix those. Is that something you want done?" And I said, "Yes."
People who have arthritis in their knees usually have either bow legs or knock knees, and she had both. She had what's called the windswept deformity, so she was bow-legged on one side and knock-kneed on the other side. So her knees looked kind of like, looked like the wind swept them to the side. Both of them were pretty bad, and both of them needed to be done because she was pretty restricted really in her mobility. So we offered to take care of both knees one at a time.
Then they brought me by ambulance and I was over on wheels. That's the short-term rehab. And I was there a month after each surgery.
With joint replacement, there's a big role for post-operative therapy, I think, because you could do the surgery, and if you don't rehab the way you're supposed to rehab, then you're going to be very limited in how much function you're going to have in your knee.
It's afterwards that's hard. It's a therapy that you don't want to move, but you have to.
Sometimes you have to push the patient a little bit more so that they can get the motion they need to get within a reasonable amount of time. Because if you don't gain range of motion early on, then it's going to be hard for you to get it later on.
They push you hard, and it's good.
This is where I think she did really well at HealthSource, because when she came and saw me post-op, initially she was still stiff, which we were expecting, but then as she went through the therapy program, I don't know, she tells me that she was pushed to the limit where she would have tears in her eyes, but sometimes you have to do that. It's not trying to be mean or anything, but it's because, the early gains you get are the ones that are going to serve you long term.
Because there's a lot of people that cry they don't want to do it, but they do it in a very gentle way. And if you really can't do it, they'll give you a few minutes to rest, get your breath, cry a little bit, and they'll come back at it.
So I think just sticking to that therapy protocol post-operatively where she was at HealthSource helped tremendously.
It's unbelievable how straight my legs were compared to what they were.
I am very pleased with the outcomes. Sharon's probably one of the worst cases that I've done.
Sometimes I look down my own legs and I don't recognize my own legs.
Service provided is quite exceptional, I think. Sometimes what sets places apart is the service. The service patients get over there, and maybe it's my experience with the communication that I have with whether it's therapists or physicians has been quite good. It helps when you have a facility that the people working at, because you know that you could trust the care that you're going to get.